So we're here with Dr. McCartney Goff of Inspire Life Chiropractic. And she's going to talk with us today about how she cares for mamas, babies, families with her gentle touch approach.
Thank you for having me, Anne.
Thank you for talking to me today. My first question, of course, is Milo there with you?
You bet. I made sure of it. He's taking a little snooze, but I'll wake him up.
I didn't know.
There.
I wasn't.
There he is.
His nap schedule. Milo.
Yep. When it's raining, he is always napping.
Oh my God, I love it.
He'll go back on my lap now, under the blanket.
All right. So I'm so excited to talk to you today. We've talked a little bit. So I met you at North Clackamas Chamber, of course, #ChamberLove. And it's been a pleasure getting to know you over the last few months. I love how positive you are and how sweet. And I can just tell that when you meet with your clients, you create this loving, supportive, healing space for them. So tell us a little about who your favorite people are to work with.
Yeah, absolutely. As you had mentioned, I specialize with pregnancy, pediatrics, and family wellness. And I am all about keeping the family healthy, not just getting them out of pain. And so I have extra certification to see those populations. Webster Technique is a special technique for pregnancy. And then I have taken the International Chiropractic Pediatric Association, their seminar series for caring for kids. So I love seeing families.
And this Webster technique, pregnancy, but then let's back up a little. You also help people that are struggling to get pregnant. Is that correct?
Yeah, absolutely. Preconception care is super important. And I'm a neurologically based chiropractor, which means I focus on your nervous system. And if there's miscommunication between brain and body, brain and uterus, just miscommunication with the hormones, well, we know the brain controls everything. And so we want to make sure that you're clear and connected for preconception, pregnancy, and post-labor.
And then I know a lot of my pregnant clients, it's often SI joint, low back, and or between their shoulder blades, right? Because your whole spine, everything is shifting in your body and the weight
absolutely
more forward.
Yeah. SI, pubic symphysis is a common thing that we see. Round ligament pain, and that usually refers to the groin area. So all of those things are common things I see in my practice.
And then you work with babies and children. So I think some people don't realize that there could be something that a little baby might need fixed.
Yeah, absolutely. That's a lot of 60 to 90 pounds of pressure on the head and neck, and no matter which way they're born. So we want to make sure that we're keeping their nervous system functioning as best as possible and making sure they're moving well too, so that they can latch properly, move their head well, and that helps them meet their milestones and develop properly.
I love it. And then you got into this because you received chiropractic care when you were younger. Is that right?
Yeah, absolutely. I wish that my family knew about it when I was even younger, but I first found out about chiropractic when I was 16, and I had my own low back challenges throughout my entire life, and it got worse and worse in high school. Finally, it was the last straw, and we went to the pediatrician, and they did lots of x-rays and exams and couldn't find anything. And they sent me to PT, which was great because I got stronger, but it didn't get to the root cause and get rid of my pain. And so I met a chiropractor at a women's fair and doing free spinal screenings, and which is why I love to educate the community myself and do that and give back. And I went, and he was the first doctor that empowered me about my health and made me feel like I wasn't broken. And because we know the body's intelligent, it just doesn't, it just needs no interference with the nervous system. So it took a few months, but I was able to get rid of my low back pain through chiropractic care, and I was able to focus better in school. I was able to sit rather than standing in the back of the classroom, and I was able to feel much more comfortable.
Awesome. I love this success story, because if you're in pain, you cannot focus. You cannot do. It's hard. It affects everything.
At any age.
And then the term that you use is neurologic interference. Am I saying it right?
Yeah, yeah, interference with your nervous system.
And tell us more about that.
Yeah, so we know that when there's a misalignment in the spine, those nerves run through the spine, and that's our protection area. And so, if there's interference between brain and body because of a misalignment, then think about if that nerve is going to your heart, to your lungs, to your stomach. So, those are things that we may not feel, but that's also how we function. And so, I want to make sure that your people are not only feeling well, but functioning at their best too. And that's how I see people have their best quality of life. They're sleeping better, they have better digestion, and they're able to pick up their kids and play with them a lot more comfortably.
So getting them back to daily activities, moving throughout their
Absolutely.
day.
Yeah.
I love it. I love it. And then what about, you talk about whole family care. So, you mamas and babies, but maybe grandpa needs a little help. Do you have older clients?
You bet. I have lots of grandparents, even my own grandma. I take care of her and see her twice a week. But yeah, grandparents and dads, they're super important part of the family because, they're caring, they have their kids that they're caring for too, grandkids that they're caring for. And just this past Halloween, we had a grandparent was able to go trick-or-treating with their kids and their grandkids because they were feeling much more comfortable and able to walk in the neighborhood better.
Oh. And then you talked about the empowering part. I feel like our culture and sort of Western medicine is, the problem has gotten so bad that now you need some kind of medical intervention or need to be fixed, right? Versus like before it gets to that point, this is kind of the Eastern approach, right? You a little signal from your body that something's a little bit off, tackle it then before getting to this point where you need to be fixed. Is that how you view this?
Absolutely. Yeah. We want to get to the root cause. We don't want to put a band-aid on it or give you a pill or anything like that. That just covers up the symptoms. So that's why I focus on the nervous system, because that controls everything in the body. And so by making sure we start there, then we can go from there of, do you need nutrition help? Do you need movement advice? And because we know that health and wellness is many different aspects, but getting to the root cause, starting there and then branching out is definitely important.
And then you do a lot of community outreach. You do a lot of community events. I know y'all did a little trunk or treat with Halloween. Yeah. Tell me more about, do you have anything coming up?
Yeah, we love doing outreach events. Like I said, how I met my chiropractor was at a women's fair. So we one of the ways that we do that, we either put on events or we attend events. So the trunk or treats we were able to attend. There's a healthy one from a dentist that they put on, and then a church. And we were at the bridal expo. So lots of families, babies, kids there at the bridal expo. So loved serving and educating the community that way. So what we do is we take the technology from our office and bring it out into the community and just do a scan of the neck, showing the stress in the nervous system in the neck. And that way people can get a little snapshot of what we do in our office and how we do a assessment. And upcoming, we like to do paint with the doc events with our fellow chamber member Venvino Art Studios, and they love putting on fun events, and it's a really fun place for families. So we're hoping to have one in the December time to be able to decorate ornaments or Christmas decorations.
Fun. And so you talked about some diagnostic stuff. What would you expect, like the first visit to your office? Would they get x-rays, or what was this thing you were talking about, scanning the neck?
Yeah, we do a nervous system assessment and checking the function and where the stress is located in the body. And then we do a muscle assessment, checking how the spinal muscles, if they're balanced, are working too hard on one side or maybe not hard enough on the other. And that gives us a better function or better assessment of what people can't necessarily tell us, because we can hear about the aches and pains, but we want to see the 90% of the nervous system that you can't feel, which is controlling the organs. So we also have the capability of doing digital x-rays in our office. So that way we're never left guessing with anyone's health.
I love it. Have you had any surprises recently of an outcome that surprised you or in a client experience?
Yeah. One of my favorite testimonials is of a pregnant person who is 36 weeks pregnant, and she was referred in by the PT that was next door to us in the Sunnybrook Center. And it's a pelvic floor PT. It specializes in women's health, so it's perfect. And she was having some major SI pain, like you were talking about. And she was actually walking with a cane, and she wasn't able to put any weight on her left side. And at 36 weeks pregnant, I was like, it's probably going to take, the rest of her pregnancy to, see some sort of results. I wasn't sure how quickly her body would respond. And that was the most surprising testimonial, because in 5 visits, which was about a week and a half, she was able to walk in and out without her cane. And she was able to go walk around the Oregon Zoo with her toddler. And that's what she wanted to get back to, is feeling comfortable walking again. And she was able to do the stairs in her house, and just those quality of life things, even before she had the baby, really made a difference in her life.
That's awesome.
And then, of course, we got to see the baby after she had the baby too, which was really great. So making sure that the baby was able to latch on both sides and function at their best it's one of the most rewarding things, I would say, is to take care of mom throughout her pregnancy and then be able to see baby afterwards.
And then how about a challenge? Was there something that you got stumped on recently, or something that was challenging for you?
Yeah, the things that are challenging would probably be the shoulder. As we know, there's lots of things that can be going on with the shoulder, and there's lots of joints there. And a lot of people think that the rotator cuff is one thing, but it's actually multiple muscles. And so pinpointing exactly, isolating what's going on can be a challenge. And so extremities or joints outside of the spine can be a challenge, specifically the shoulder. Someone had some pain in the front of their shoulder, and they weren't able to move their hand very much, and that was pretty challenging. But getting the scapula or the shoulder blade moving well, that definitely helped them. But that's probably one of the most challenging things that I've seen so far. It's not an easy joint.
Isn't the shoulder the weirdest joint? There's like a bone, and then a bunch of soft tissue that's just this mishmash. There's lots of stuff that could go wrong.
Yeah.
And then what do you love about your recent-ish transplant to Portland?
Yeah.
So beside the rain, what else do you love about it?
Yeah, we've had some interesting weather. Well, Portland, I love the health community of Portland. I came from the Midwest, and people didn't know what a doula was or what a naturopath was, or it was rare to see an acupuncturist. And so convincing people that chiropractic can help you not only get out of pain, but stay well and stay healthy, being part of your health journey, was different here in Portland in comparison to the Midwest, because people really care about their health here. They go to the massage therapist, they go to acupuncturists, they know what building a birth team is. And so it's more health conscious here. And I really love that about Portland.
Right. In other parts of the country, they're like, what is this thing? In Portland, they're like, I specialize in this type of thing.
Exactly.
And then what is Milo's role at the clinic?
Milo's role in the clinic is very essential with the cuteness factor. So,
of course.
So my practice members often ask about him and how he's doing. I have a lot of dog lovers in my office, which you may see on my Instagram, with anything from a tiny little teacup Chihuahua dog to bigger dogs that just lay underneath the table while their owner's getting adjusted. So we are definitely a dog friendly office. And because they help, I was just listening on the radio, they help with the feel good hormones, the oxytocin and serotonin. And, what great way to do it, but with, having animals surrounding you, loving you with that unconditional love too.
It's hard to be stressed out when you got a warm animal on your lap that you're petting.
Exactly. Yeah.
This is a very Portland thing, right? People bring their dogs everywhere. You go to a cafe, the dog is sitting under the table. You go to the grocery store, dog, bank, dog.
Yeah. One of our practice members, that teacup chihuahua goes right in her purse. So I have a picture of it. It's so cute. And I didn't even know it. She spooks me. She's so tiny. She pops out of the purse. And one time she got caught, her head was in a Ziploc bag. She got caught in there, licking the treats in there.
Oh my gosh. All right. What else do you want to share with us that I haven't asked you about?
Well, I would say one of the highlights that we had recently was a 2-day-old baby. And so a lot of people have a misconception of what it looks like to adjust a baby and what type of adjusting, we can do. And so for the type of adjusting that I do in my office, I don't do any twisting, popping, or cracking for any age. And so it's more of a gentle approach. And that's why I say I'm nervous system based too, because I focus on your body telling me where to adjust, not necessarily chasing the pain. And for babies, it's just with my little fingers, as gentle as testing the ripeness of a tomato or an avocado. That's how all the pressure that they need, because they don't have the muscle tension, the stress, and things that as we age, that add up over life. So, but it's important to know that it's not about age, right? It's not about how old you are, because there's 90-year-olds that are running marathons, and it's more about how much stress you've had on your body throughout life and how much that adds up. And so that's why I focus on making sure that healthy kids grow into healthy adults, and make sure that's great for the whole family. With this intermission, I shall bring Dr. Milo back.
So Milo's making another appearance. We just Milo. Every day we like to have a dog. All right. Well, this has been so lovely chatting with you. I love seeing you in person. I love seeing you on Zoom. And I appreciate you sharing with us how you are helping mamas, babies, grandparents, whole family, restoring their life, bringing them out of pain, but also giving them the ability to do daily activities, things with their kids, fun things.
Absolutely. I love to get people moving, and then I know that your job is to keep them moving. So that's why I love working with you, Anne, and many other practitioners to make sure that people are staying healthy.
Yeah, so some good connections and referrals for you would be PTs, other trainers, exercise, people that lead yoga classes maybe, or I know you work with other chiropractors.
Yep, absolutely. Any health and wellness specialist because like I said, health is many different aspects, and it's good to stick to the basics of sleeping, eating, and doing all that right, and getting that movement in. So, and then I help keep you moving.
I love it. All right. Well, thanks for chatting with us. This has been so lovely. And we'll see you soon.
Sounds good. I'd like to say I'm grateful for you having me here. So thank you very much.
I'm grateful for you.
Have a great day.